This guy's wearing the spring, summer, and fall collection.
Jeez.
Whoa! Hey. Extreme floating faces, dramatic hospital drop-offs, and the ultimate emergency room surprise. Today, you're getting just a taste of the medical chaos that I deal with on a daily basis as an emergency room doctor. All from a medical show I love called The Pit. Let's dive right in.
23-year-old Ben Kemper, no helmet, got doored riding an e-scooter. Neck versus handlebar, then face planted to the pavement. Obvious facial fractures, but alert and oriented with good vitals.
A lot of jargon, real quick, really fast, but this is what the paramedics give us as they're rolling into the emergency department so we know the pertinent information that we need to know.
How we doing, Ben?
Blood back in my throat.
That's probably from the nosebleed.
So he's feeling stuff in the back of the throat and they're suctioning out his mouth. He's bleeding going backwards. So that's why I always tell people when you have a bloody nose, pinch and lean forward. Don't go back because it's just going to pull to the back of the throat. It's going to be uncomfortable. It's going to clot back there.
Short, rapid rhino, please.
Tachy at 120, pulse ox borderline at 90.
The other thing that we're seeing is all his clothes are cut off. And in a trauma incident, you are going to get your clothes cut off, unfortunately. The hospital does have clothes that they will give you later if you don't have clothes, if you're able to get out of the hospital in a timely manner before somebody can bring your own clothes. But we need to expose and double check everything.
Blood by at 15 liters for now.
Neck contusion, larynx shifted to the right, no crepitance.
4 of morphine. I'm gonna stick something in your nose to stop the bleeding. Inflate the balloon. How about now, Ben?
So the Rapid Rhino has gauze on the outside with a type of balloon on the inside. And the gauze you wet a little bit so you can stick it into the nose on the side where you think the bleeding is going on. You put it all the way in and then it has a little device tubing on the outside of it, which you stick a syringe attached to it and you put air into it and it blows it up so it pushes pressure against the walls to get the bleeding to stop.
Better.
Let's have a look.
There you go.
Ouch.
Floating face.
Before 3 fracture.
Whoa, there you go. He's got a little bit of a Lafort fracture. So this is a mid-face fracture. There's different grades of it. He just moved his whole mid-face.
You don't see that every day. Okay, let's prep for an airway. Double setup just in case.
Ketamine and sucks on board.
Pulse ox holding at 94. Prepping the neck just in case.
Let's have a look. Yeah, really distorted from the trauma, and the demon's only gonna get worse.
Prepping the airway, and they did blow by. You can see that there's an ambu bag, which is the blue bag with a mask on it. And so full oxygen, just blowing the oxygen by so it helps the individual breathe. And you're basically trying to set this person up for pre-oxygenation before intubation, which is what they're going to do. And the medications that they are going to use, they're going to use ketamine and sucks.
Caucasian male, approximately 60 to 70 years old, found unresponsive. No signs of trauma, no ID.
On 3.
Very common occurrence. So unresponsive, altered individual, no ID. So you basically start out with different scenarios. You want to check your vital signs. That's the easiest thing to do. Then you're checking a glucose level. Then you're using your other senses. Look at the patient. Make sure there's no signs of trauma. They say no obvious signs of trauma.
1, 2, 3. Ooh.
Yep. Okay.
Did you take anything?
Smell the alcohol from here.
This guy's wearing the spring, summer, and fall collection.
Jeez.
Whoa! Hey!
What the?
Oi.
What's wrong with this? What's going on?
Patient tested positive for rats.
This can happen. I've never had rats come into the emergency department. Maggots, yes. Wounds infected with different bugs, yes. Sometimes people bring in the snake that bit them, sometimes alive, sometimes dead. Those are the most common animals that we see.
If it matters, I only counted 3. Oh, there goes 1.
You think about the patient now too. So unresponsive patient that smells of alcohol. But you can't stop there. You can't just be like, oh, they're drunk. Because you don't know if they actually have been drinking all day and then just fell and cracked their head. Even though they don't have any signs of trauma, maybe the hair is blocking it. They might have an intracranial bleed.
Sorry. So what happened?
I bought it for my girlfriend's dog. I was
Oh.
yaps all day long. And when I woke up, I was wearing it. Stupid bitch. Go.
I'm not sure I'm a fan of shock collars to begin with, but I mean, we always say like, would you like it if somebody did that to you?
Sorry.
I think she must have used used crazy glue.
Yeah.
Crazy glue to the skin. If you try to rip it off, you might actually rip the skin. We've had patients who crazy glue their eyelids shut by accident. You can use different petroleum type jellies that will actually break it down.
It looks that way.
Have you tried removing the batteries?
Of course, she glued the case shut.
All right, I think we have a couple options, Gary.
Yeah, so typically you can find a solvent to slowly dissolve it, and it would probably take a couple hours to break it down. You can call the pharmacist. Typically there's one in the emergency department. See if there's anything that they have that could be a solvent to dissolve. You can also call the poison control center and see what they recommend.
We can try to find a solvent that will dissolve or at least soften the glue enough for you to peel it off without taking your skin with it. Or, Dr. Fuddy.
I guess your skin cells on your neck will naturally slough off, and you should just be able to remove it in time.
You know, the concern also is he's getting these electrical shocks. Are they dangerous? The concern is the shock dangerous enough to cause electrocution to the individual, causing cardiac abnormalities? So unlikely, but you know, repeated shocks to this area could cause potential inflammation of the airway itself, which could be dangerous, could also break down the tissue of the neck. So just something to be aware of. This should not be on there for a very long period of time. Ooh, helicopter pad. Yes, doctors can meet the helicopter up on the helicopter pad with the patient, but in the hospitals that I've worked at, we don't. We stay in the emergency department, and sometimes the nursing staff will go up, but they're still with medical professionals on the helicopter, and they bring the patient to the emergency department. It just depends.
Live wire hit his left forearm. Shocked him once for VFib.
Was there a power pole down?
No, abandoned factory. We found bolt cutters at his side. Got electrocuted.
So electrocution, sending the patient into VFib. The patient is intubated at this current time. They have fluids going. They must have IV access, and I want to know what their intervention was.
Try to steal copper? Most likely. Power line fried his arm, and the current through his whole body stopped his heart.
Added myoglobin and a CK to the labs. 2 liters normal saline wide open.
Guy fell off a telephone pole?
Myoglobin and CK level has to do with muscle breakdown, so they're looking for rhabdomyolysis, which you'd anticipate when somebody gets a bad electrical injury.
No, he was on a platform.
Boring.
Cut into a live wire.
Oh, white arm. So when the tissue looks white like that, it's basically a 3rd-degree burn. It doesn't cause any pain, but it's just basically charred tissue at that point.
Tense ventral compartment.
Describing a tense compartment, you're concerned about compartment syndrome. Compartment syndrome is when the tissue is very tight and there's still swelling underneath. It decreases the blood flow to that area that you're feeling, which increases the risk of ischemia, and then the limb could potentially die.
VFib.
All right, charge to 300.
Am I running this or are you?
Sorry, reflex response.
Clear.
And unstable VFib or VFib with somebody who does not have a pulse is when you need to shock. They're charging to 300, which means they have a monophasic defibrillator, versus 200, which would be a biphasic defibrillator.
I am sad.
I need help. I got stuff.
That is a drop-off. There's other terms for it, but this does happen. I've had many in my career where somebody just drops off a patient at the front and they're gone, and they've either been shot, stabbed, on death's doorstep, all different scenarios.
Can you guys help? What's your name?
Alex.
Okay, Alex, let me take a look.
Stab wound to the right upper quadrant of the abdomen. You're looking at a liver injury, potential bowel injury, or even diaphragmatic problem or into the lung. So it just depends.
Oh, I know. All right, we're gonna take good care of you. You guys got it up here, Alex.
Oh, so EMS is helping, which they didn't actually need to do. They put them on their stretcher to roll them right into the emergency department.
Call the OR. We'll be right up.
Lungs up.
You take medications every day.
Because it's this type of injury to that, you know, abdomen, that side, they know they need to go to the OR anyway, so it's prepped, but the patient needs to be stabilized as best they can before going there. And they're doing a fast exam, so a focused assessment, sonography in trauma.
Morrison's a full blood. See that?
Yeah.
Tore up his liver.
What's his name?
Morrison's pouch, what they're describing, there's fluid there. Fluid most likely is blood. And basically it's the area where you're not supposed to have a pouch between your kidney and your liver. So you look to see if there's any black fluid there. And if it is, then it's probably not like ascites fluid, it's probably blood.
Where are we going now?
We need the room for someone else, but you can rest in the hall till we get your labs back. How's your pain, Mr. Milton?
I'm fine. Could use a latte, though.
They're moving the patient out of the room and putting it in the hallway. Where I work, you're not allowed to put patients in the hallway anymore because you have adverse events where sometimes if patient's not on a cardiac monitor, something bad could happen.
Well, that could bring back the gallstone pain. 68-year-old male, history of hypertension, 1 hour of right upper quadrant pain after eating a fatty meal, now resolved. Afebrile, non-tender. There was a gallstone present on POCUS.
Classic symptoms. Right upper quadrant abdominal pain happened after eating. Typically that's called biliary colic. If it had continued to have abdominal pain, then you're having pain related to the gallbladder, potentially, and gallstones. You need to then do blood work to see if there's abnormalities of the liver function test and the bilirubin.
EKG shows no acute ischemic changes, but I'm still waiting on LFTs and lipase.
Why did you order the EKG?
The nurse suggested it to rule out any cardiac issues.
Well, good call on both your parts.
Nurses are a very good resource. They are with the patient more than the doctor is. They have many different experiences. If they suggest something, we do take it very seriously.
Find me when those labs are back.
We have to move you into the hall. I know it gets pretty chaotic and
So they
noisy
haven't done
out
the
here.
labs yet, okay.
Mr. Milton? Hey. Hey, Bennett.
Oh.
Wake up for me?
Unresponsive. Scary situation. Now you're like, uh-oh, I need to get this patient to a resuscitation area, but start compressions right away and call for help. When you call for help, other people will come helping, get other doctors around, and you start your ACLS protocol. Wow. Okay. So The Pitt. The show is fun because literally this is what I do for a living. It is entertaining to me and they're actually quite accurate. If you guys enjoyed this and you want me to do more, let me know in the comments, and definitely check out this playlist right here. Binge watch everything, and please make sure that you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.